Hi, my name is Nicole Quigley, and I will be discussing the higher mortality rate among Black women with breast cancer than white women with breast cancer. Black women have a lower incidence of breast cancer but a higher mortality rate compared to white women. The mortality rate for Black women with breast cancer is 42% higher. Using the vulnerability model, I will be discussing the predisposing, enabling, and need characteristics of this underserved population and how to address these disparities. First, in the vulnerability model, are the predisposing characteristics. One of these characteristics is the racial factor. Black women have a higher mortality because of breast cancer. They are more likely to have triple negative breast cancer, which is associated with higher mortality, but this is only a small factor in disparities. Certain cosmetic products like skin, hair, and nail products are often marketed to Black women and contain harmful chemicals that can increase cancer incidence and mortality. Another racial factor affecting breast cancer mortality is comorbidities such as hypertension, diabetes, cardiovascular disease, respiratory disease, and obesity, which are high among Black women and associated with higher breast cancer mortality. Gender and age are another predisposing characteristic. Black females have a higher incidence of breast cancer at a younger age. Breast cancer is also more likely to be found at an earlier stage in white women versus Black women. Another predisposing characteristic is geographic location. Black women are at a higher risk for breast cancer mortality when they live in rural areas or further away from quality medical facilities. Next are the enabling characteristics of the vulnerability model. Insurance status is the first of the enabling characteristics. A lack of health insurance results in lower mammogram participation, resulting in higher risk of cancer death. In 2017, 11% of Black people were uninsured compared to only 6% of white people. A study by the American Cancer Society found that differences in insurance status was the most important factor contributing to the higher risk of death among Black patients. Low education and low socioeconomic status are enabling characteristics and can predict less screening for breast cancer. In 2017, the proportion of Black people living below the poverty line was more than double that of white people, and many of them lack insurance. If the world were 100 people, 84 would be making only $0 to $20 per day. These people do not have the time or money to be getting a mammogram. These costs are a concern even with insurance because of deductibles, co-payments, and loss of wages. People with low socioeconomic status have difficulties managing transportation, childcare, and their work schedule, so they have difficulties accessing healthcare, like mammograms that are usually available only during working hours. Because of segregated housing patterns, limited transportation, and other barriers, Black patients have to choose a health facility that is closest and most convenient rather than high quality, causing them to receive inadequate care. Now I will be discussing enabling characteristics at the community level. Black women are more likely to be screened at lower resource and non-accredited facilities. A study of patients with breast cancer in Chicago found that differences in the method of detection and facility accreditation accounted for nearly all of the racial disparity in breast cancer stage at diagnosis. Another enabling characteristic is race-based discrimination. Subtle or implicit thoughts or actions of healthcare providers can result in bias and disparities in care. 57% of Blacks in a national survey said that discrimination occurs often or very often in their interaction with white physicians. 75% of medical interactions for Black patients are with a non-Black physician, which has been shown to result in less positive and productive medical interactions. White physicians may spend less time planning treatment, providing health education, building a relationship, allowing for patient participation, and answering questions. Because of discrimination, Black breast cancer patients were even more likely to be underdosed or given non-standard chemotherapy regimens than were white breast cancer patients. Now, I will be talking about the need characteristics of Black women in relation to breast cancer. Need characteristics include screening, diagnosis, and treatment of breast cancer. Screening rates among low-income Black women are low, and screening has been associated with decreased breast cancer mortality among women. Providing this population with adequate care involves addressing their concerns and decreasing their anxiety. This anxiety and worry is due to fear of results, fear of pain of the mammogram, and fear of an inevitable death. Possibly because patients are not properly educated about the breast cancer screening process, results, or treatment. Anxiety and fear is also due to previous negative experiences with the healthcare system and a lack of trust in a healthcare provider. Now we'll be discussing how to address this disparity in breast cancer mortality, keeping in mind the vulnerability model. Overall, there's a need to expand access to high-quality cancer prevention, early detection, and treatment, especially for Black women. There are a variety of ways to do this. There can be community partnerships created with hospitals, academic universities, state departments of health, and other organizations to work together to provide follow-up, case management, and low-cost quality care. Because there is a lack of trust in the healthcare system, trusted members of the community can provide testimony to community members about positive breast cancer prevention behaviors so that they also adopt these practices. Because there's a lack of insurance and low socioeconomic status among Black women, we need to make sure that patients who are eligible for Medicare and Medicaid are enrolled. Expanding Medicaid and instituting the individual mandate of the Affordable Care Act once again could help these vulnerable populations. In addition, having community health centers with sliding fee scales to accommodate those with low socioeconomic status may also be useful. There needs to be high quality, accredited facilities for even those who cannot pay. There also needs to be more flexibility in mammogram screening hours to accommodate those who can't miss work. Physicians also need to do a better job of educating patients about the process and discomfort of mammogram screening benefits, results, treatment plans, and follow ups. Physicians could also use telehealth for patient education and have web based modules and patient reminders. There's also a need for cultural competency trainings for healthcare providers so the screening experience is more positive for patients and therefore more accessible to Black women. Thank you for watching. Here are some discussion questions. What factor of the vulnerability model do you think is the hardest to address and why? What is your role in your future health profession in minimizing healthcare disparities like this one?